And hey everyone, it's Evan Kirstel and Nirma Rastagaeva of Vera Health. And today we have two of our guests, clients, and big fans of 3M. So we're really excited to have a chat with 3M. It's kind of a post game recap, not of the football this weekend, which was fabulous, but of
Yes, it was.
CES, which was earlier this month. And there was quite a lot of interesting content and news broke there. So we're here to chat about it, even though it was a couple weeks ago. Let's do some introductions first. I feel like Tony Kaufman here on my bottom right. I feel like you're on the Weather Channel and you're reporting from the field. It's currently 11 degrees in Minnesota, so you may start a fire at any point just to keep warm. But how are you, Tony? What do you do at 3M?
I am doing well. Thank you, Evan. Thank you, Irma. I am the Senior Business Development Manager for our 3M Medical Device Solutions business. So, in my role, what I do is I work with other medical device companies to collaborate, bring 3M science and technologies to their company, and hopefully identify those new and disruptive solutions that will bring something new to healthcare.
Fantastic. And to your left, this is like family squares or something.
Right.
To your left, you have Dan Durenberger. Dan, you want to introduce yourself and your multifaceted role at 3M Healthcare?
Absolutely. Well, thanks. Great to be with you all today. My name is Dan Durenberger. I also work with 3M Medical Materials and Technologies in business development. And the focus of my role is primarily on some of the larger medical device companies that we work with, global strategic accounts. One of them being Abbott that we work with, which I know we'll touch on a little bit later. But yeah, as Tony said, I'm sort of the intermediary between a medical device company designing new devices and all of the technical resources available at 3M, whether it's in our business or across divisions at 3M to help enable medical devices.
Fantastic. And Dan, you were on the ground at CES. Give us your fresh, feedback perspective on the show, on the event, maybe, a bright spot, what you saw or learned this year.
Sure. Yeah, I got to tell you, the first thing was it was just great to be out and with customers and with folks. And, even though I remember back in the day, traveling seemed to, you'd complain about travel, but I'll tell you what, it was great to be out. And I loved being face to face with some folks. And I think one of the highlights was, just being out and about. But actually, I have to tell you, one of my highlights was going underground and trying the Vegas Loop that I had not tried before, Elon Musk's little Vegas Loop. So I'm a Tesla fan, never been in one, so it had me a chance to sit in a Tesla and spin around a little bit. So that was kind of
fun. Well, now I'm feeling jealous. And Dan, what about Tony? Rather, what about you? What's one of your highlights from the event? One of your takeaways?
Yeah,
share.
I'm so sorry. My audio went out.
I can hear you now. Can you hear us?
There we go. Now I can hear you. Hi, I'm so sorry.
I was just asking, give us one of your highlights from CES, one of your takeaways that really, made a difference for you this month.
Yeah, I would say one of the highlights. I mean, like Dan, I just was excited to get out and talk to folks one-on-one. But really, the highlight for me was really the feature of healthcare in CES. Really, that consumerization and the digital health world really has brought home really the technology and the movements that have been going on in the industry. So having Abbott as a keynote address was really a highlight for me. And being in that industry and walking around talking to folks, it was refreshing to be able to talk shop with folks around CES.
Mm-hmm.
Awesome. Well, I wish I were there. Irma and I were there last year, and Irma, you were not there. Irma Rastagaeva of Vera Health. So you kind of watched from afar like myself. What about you? What do you think? What did you miss most not being there this year?
Oh, well, of course, this component that Tony and Dan are talking about in terms of being there in person, being able to reconnect with people that maybe we haven't seen in the last couple of years during the hiatus of conferences, as well as meet new people and see what is the latest and what people are excited about in the world of health and technology. Was also so interesting that CES for the first time put an official spotlight on having a keynote from the health. Personally, I was actually very surprised that really this is the first time we had to come to 2022 for health to officially take really a center stage at CES, even though in the prior years we saw more and more presence of wearables and digital health and other health-focused health and wellness focused devices. So I was glad that it basically CES became, mostly about health and health tech and digital technology, and how other technologies either already focused on health or not quite yet might become eventually huge contributors to this field.
Great. Any questions for our friends from 3M? I don't want to hog the stage here.
Absolutely. So obviously we know, and maybe you can tell us a little bit more about how 3M in particular had to pivot to this new format, the CES being hybrid event, and also with Omicron being such a huge disruptor. So how was that aspect for you both personally, and how did 3M MedTech team pivoted to rise to the challenge of CES?
Yeah, I would say, I mean, from our standpoint, the team, I'm sorry, I'm having audio issues again. Dan, could you take that?
Yep. Yeah. So I think, there were a few things just from a logistical standpoint that we had to deal with like everybody else. We had a larger team that had planned to go. And I think literally 24 to 48 hours before the event actually started, we cut that down to just Tony and I for a lot of different reasons. But at the time, the news was sort of really focused on the rise of cases and things like that. And so we went and we're used to having a larger presence, and I hope that we have a larger presence in the future. But under the circumstances, I think, we were able to cover CES the way that we had planned to. There's a lot of digital tools now. You mentioned digital tools and things that can help you and have helped us through these COVID challenges. So it helped us to plan, the folks that we wanted to see and the technologies that we wanted to look at and focus on. And then where there were some areas maybe where we were not able to get to, or as we were meeting with businesses and medical device companies that had a global presence, and we wanted our colleagues from around the world to engage, we were able to quickly share that information with them, and they could follow up in their various parts of the world. So there was even a point where we needed to do some pivoting with our actual presence there in booth, and Jackie did a great job in the team of helping us remotely as well. But overall, it was, after 2 years of having to be adaptable in all of our work, it just sort of carried over into attending CES as well. So it was good.
Tony, are you back with us?
I am back. Sorry, guys.
No, not at all. So tell us, what about your perspective? What are some of the meetings, the highlights of finally an in-person activity?
Yeah, I think a lot of it was, the biggest takeaway I got from CES was people are hungry to collaborate. I think, over the last 2 years, there's been a lot of good ideas, a lot of people willing to help. And especially in the area of healthcare, people want to make an impact. And that was felt throughout CES. The need for technology, the collaboration has always been there, but this underlying need of saying we can do more together, that we can accelerate these technologies that we've been talking about for years, and really let's come together and bring that solution to bear. I think over the last 2 years, we've seen the impact that these technologies can have. And there's just so many people out there that just really want to have that impact, not so much from get their device out there, their name out there, but to really make an impact on, those that live around us. And that was a big takeaway for me. It was really refreshing to talk about what we can do to impact the lives of others versus what can we do to make this technology become commercial. The need is there, the passion's there, and it got me very energized to return to work and start talking about some of these new technologies.
Awesome. And Dan, let's dive into the health tech side of what we do here. You're a bit of the unsung heroes of 3M. You're not the guys making all the PPE that the public sees, but rather You're collaborating with medical device companies and wearable companies, innovating almost in a sort of invisible way that people might not realize. So Dan, what are you seeing in terms of some of the breakthrough innovations? Were you able to highlight any of those at CES? You maybe give us some juicy details, if you would.
Sure, sure. So I think we talked about it a little earlier when we started seeing more and more wearables, medical and healthcare related wearables, maybe in 2019, 2020, but it seems to have really accelerated and taken off. And there's a lot of different folks now, from startup companies all the way to the largest medical device companies on the planet, like Abbott, for example, who are doing some very interesting things. And it's a combination of what used to be healthcare delivered in a clinical setting, carrying over to the need to be able to deliver and receive care in the home. And I think one of the most impactful things I saw during the event was, as part of Abbott's presentation, their neuro stimulation device that they had implanted. And if you haven't seen the keynote, it's great. But there's an actual patient of Abbott's that has a device that for neurostimulation implanted, and it can be controlled. His doctor can control it from her office while he sits in the comfort of his own home. And to actually witness, he was challenged with Parkinson's, I think it was. And so you could actually see the physical impact of the adjusting of these wearable and implantable devices from a doctor's office while the patient was sitting at home. And that was one really powerful example to actually witness that. And it demonstrated that there is so much more going on with wearable devices in healthcare that is empowering patients and empowering consumers. And we may touch on a couple more. There's so many to talk about, but that was really impactful to me, just the underlying theme of empowering the consumer and empowering the patient to be able to receive and actually control, to a certain extent, the own care that they're getting. It demystifies it a little bit. It helps patients and people to become a little less maybe fearful of receiving care when you can take these things into your own hands. And just to be able to do that remotely is incredible. And I think we're just now starting to see this acceleration of innovation in that regard too.
Very cool. And Tony, similarly, I was reading an article that Irma wrote about the wearables in the age of COVID, talking about a bunch of the solutions that 3M has, and things like adhesive design and, building solutions bespoke for different segments of the market. What's one of your favorite stories around working with clients to that effect?
Yeah, I think a lot of it is that it just, there's so many things to consider when you're building wearable devices. And I think Irma's article really hit the point of really bringing these to life. One of the best examples I had was when a customer came in with a example of a device which had all these different renderings and everything. It looked like it was just ready for a magazine, but it turned out that it didn't work. It didn't fit on the body. It wasn't really scoped to where it was supposed to be on the body.
Oh, we lost him.
Oh.
I hope he didn't fall through down the ice up in Minnesota, but hopefully he'll be back.
Yep.
Otherwise, we may need to call emergency service. Just kidding. He'll be fine, folks. He's in his truck.
He'll be okay. It's interesting where he was going with that, though, because I think I know the project that he was talking about, and it's amazing how the clients that we work with and the customers we work with, they put a lot of thought into maybe the technical side of the device or the active side of the device, and they wait until the how do we stick this to the body and where should it go and how do we make it stay on as long as we need it to stay on. They wait until the very end and they realize that that's maybe one of the most challenging things to consider. So we get the opportunity to bring our resources and our technical and clinical experts into the conversation and really help them solve some of those challenges and get them closer moving towards commercialization. So it's a fun and incredible opportunity to be able to work alongside these folks to solve some of those types of challenges.
And when we met 3M, actually 2 years ago at the CES 2020, this is where we personally got to learn more about the many sides of 3M and specifically in the medtech business, how 3M is a well-known company for developing science. In fact, the logo, the slogan is science brought to life. And then we learned how 3M is putting all its expertise and the many scientists working to develop these adhesive technologies and many many other science-based breakthroughs, and how then you work with a variety of different medical device manufacturers, wearable makers, and others to actually help them design their product with all of the important factors in mind, including the skin. Skin is our biggest organ, and especially for a wearable device, it's so important that that aspect is considered. The device has to be comfortable for the patients. Speaking from the patient perspective and the patient advocate perspective, it has to be comfortable enough to be able to wear it. It has to be gentle enough on the skin in both ways, both to while you wear it, but also so you can remove it when necessary from the skin. So it's we learned a lot about that specific aspect of designing skin adhesive technology from Audrey Sherman when we spoke with her a couple of months back. And so we met 3M 2 years ago, and we've been learning how you put all your expertise to work with a variety of clients.
Mhm.
So it was interesting when you talked about the Abbott keynote, how Abbott is client-facing, patient-facing in terms of their devices. They market their devices, but a lot of the 3M technology is kind of behind the scenes. Can you tell us a little bit more about that? And at what point does 3M gets involved with designing these devices?
Sure, absolutely. So it's, I referenced that Tony started with the conversation about a project that was already sort of in the development works for quite some time when they engaged with us. But ideally, when you're working on a project, especially with a wearable device or a microfluidics point of care test, for example, we're in that segment as well. Bringing 3M in as early in the conversation. There's Tony. Tony made it back. But bringing
Indoors.
him,
I think it's a little warmer in the truck, right?
it looks,
Right,
yes.
Tony? I think it was time to come in.
But
Sorry,
Jen picked it up and kept with the story that you started.
So, but bringing us in as early in the conversation in the design process as possible really is helpful, and that way we can maybe eliminate or miss altogether some of the classic design challenges when people maybe who don't have as much experience in working to get things to stick to the body. 3M's been doing that for decades and decades with the branded side of our business. But in what we do, we can leverage all that experience, and we can design for manufacturability. We can help them to plan for maybe some of the regulatory hurdles that will be coming. But primarily, it's how are we going to get their device to function as consistently and as effectively and cost effectively as possible. And not only is it fun working with them for the design of their own device, but when they bring us challenges like we want it to stick longer, right? Well, let's get the Audrey Shermans of the world on that challenge, and we can then come up with creative solutions, technical and actual material solutions to meet the needs of the marketplace. There's many stories, but it's a privilege to work with these companies that are designing amazing technology and wearables, and just do our part to help to enable some of that technology.
Yeah, that's really fantastic. And Tony, what about you? We talked about the amazing Abbott keynote. What were one or two of your takeaways from that keynote? And for people who haven't seen it, go rewatch it. It is really, a tour de force of medical technology and breakthroughs. What do you think? What stuck with you from that talk, Tony?
Yeah, I think the thing that stuck with me the most was Abbott had a very tough job of really talking about all this technology that's going across the industry. When we start talking about wearables and point of care devices and machine learning, those are things that can cut across the industry. But what they did extremely well was to talk about how this technology is becoming more personalized. Many of the stories, so if you haven't seen it, I would encourage anyone to go out there and take a look at the keynote. But they did a great job of bringing in personal stories and talking about how this technology, although it's based off population data and can spread across the globe, really how it's personalized and how the data of many really impacts me. And I thought that was a really cool message and really, hit home with regards to what we're trying to do in personalized health.
That's fantastic. I hope we fast forward to next January and we'll all be back at CES together and more. If you're to do that, think about a year from now. What are you most excited about over the course of the year as far as making health better for people around the world? Where do you think we'll be in a year as far as medical devices, wearables, and beyond?
Yeah, I think when we take a look at this year, I think we're going to see some very interesting collaborations with companies. I think we're going to look at ways that people are going to business differently, different business models, different partnerships, because we realize that there's so many different strengths out there that are coming across different industries to really impact healthcare. So for me, I'm excited to see how these different business models play out to really impact healthcare and bring this remote monitoring, this point of care testing, the wearable devices really come and bring it into its own. I think we'll see a lot of excitement around that, but I think we'll see a lot of need for scale as well too. That if we're going to bring this technology to the masses, we're also going to have to be able to manufacture it at scale as well.
That's for sure. What about you, Dan? What do you think about fast forwarding a year from now? Where might we be?
Yeah, I think the trend, we touched on it earlier, the trend of patients receiving and adapting to their care from home. We were forced to do that, and I don't think that genie is going to go back in the bottle. I think that as we get more and more comfortable with how to use these devices, these wearable devices, at-home diagnostics tests. I mean, think about that. That's a whole category that's opened up because of COVID, but there's so much more potential in diagnostics at home as well. I think we're going to see that acceleration, innovation and acceleration. And I think that the thing that Robert Ford said was, he said, I think it was digitize, decentralize, and democratize the future of healthcare. And I think those are powerful concepts to think about. And as they take their CGM device that's typically for a diabetic patient, and it's critical for a diabetic patient for that to be comfortable and to work, and the Libre does very well, and then carry over into the consumer market and launch Lingo, which is the ability for somebody who doesn't necessarily have diabetes, but is very in tune with their health and wants to monitor these biomarkers in order to continue to do the right things in terms of exercise and diet and all those. I think the number one thing is that crossover from healthcare devices into the consumer market. I think that's going to continue to build as well. And 3M is positioned well for both of those, for point of care testing, at home testing, and the materials that we have to fit these various devices that stick to the skin. We continue to innovate in that regard as well. So we're excited to come alongside our customers as that moves forward.
Well, it'll be exciting to watch. And Irma, what about you? What are you optimistic for next CES, hopefully with us attending?
Well, I think a year is both a very short amount of time and a long amount of time to anticipate change. Just thinking back to this global pandemic, it's been now 2 years, which of course nobody anticipated. And just think about how much change we've personally, professionally, and as patients and the whole healthcare system we've experienced in these last 2 years. So I'm personally extremely excited about what both Tony and Dan had just spoken about in terms of what we can expect in the next year. Again, from a patient perspective, from a patient advocate perspective, I am welcoming all the changes that are shifting, putting some power in the patient's hands in terms of them able to collect a lot of their own data and biomarkers. Of course, we need that to be connected to actionable insights. Otherwise, patients could get overwhelmed, as well as their physicians and medical providers could get overwhelmed if we have a barrage of data, but not very well designed and thought through ways to provide actionable insights to both physicians and the patients. So I'm looking forward to machine learning and AI to come alongside this huge influx of data to come up with these insights. And, so absolutely looking at that. I'm also wondering what kinds of changes we will maintain personally that we've the adaptations that we've created during this pandemic, as well as companies. So actually my next question to you both, Dan and Tony, was besides the quick pivots that the company had to make in preparation for CES, literally days, hours before the team was going to travel, did 3M MedTech implement anything in particular that helped you cope with the pandemic that you think might have some silver lining in there? were there any pivots or changes that you've implemented that might continue for you this year and beyond the pandemic as a business, as a team?
Yeah, I would say, I mean, an example is just what went on today is being adaptable and agile. I think we've learned how to do that over the last 2 years of really having an eye towards a mission, getting it done, right? But I think one of the things that I've seen us really adapt is being able to engage differently on a digital perspective. We have to go to where our customers are, and our customers are accessing data like never before. There's never been a time with more data at people's fingertips. And looking at the way we've done business, we have to change the way we look at things digitally, the information we provide. And we've done that. I think the tools like findmyadhesive.com has been a great accelerator in terms of modifying your business to be able to meet your customers with where they're at.
Yeah.
Yeah, I was thinking the same thing, the digital tools, and it was interesting how Find My Adhesive, was launched even before this occurred. But, there was this anticipation of a need for more tools in order to empower our customers, even maybe before we have a face-to-face conversation. And we certainly have done a great job with that. And I think from a business development standpoint, everybody's had to adapt on being as effective as possible without being face-to-face. Can't wait to get back again and be face-to-face. That's the best way to develop and strengthen a relationship. But we're all in it together, and we've all adjusted together. And I think the last thing I would say is, from an operational standpoint, the team just dealing with supply chain issues and just the logistics of running the business. Our team at 3M has done an incredible job in making adjustments in order to meet the needs of our customers under extremely difficult circumstances. And I think a lot of those changes are probably, here to stay in terms of efficiencies and things like that. So.
Wow, so exciting. Thanks, guys, for your insights and all the analysis. And, when this is behind us, this pandemic, next year, ice fishing in Minnesota, next winter. Tony, you can show us the ropes, and
Absolutely.
We'll take a tour of R&D and all that good stuff. But in all seriousness, we're, really excited to have chatted around topics that are so important to us as patients, as human beings. And thanks for all you do. Everyone we've met from 3M is just a delight to chat and work with. So keep up the amazing work and innovation.
Thank you so much. It's great to be here.
All right, everyone. Thanks for watching.
Bye.
Alrighty. Take care.